Thank you, Dr. Cardoso, for this wonderful presentation, which is full of points that itself deserve one day at least for fruitful discussion. And it's very relevant to conditions in middle income countries and very full of scientific points. Now we move to another interesting presentation. It will be by Dr. Soledad Torres from Chile, and it is about national consensus guideline development for breast cancer treatment. Okay, Dr. Soledad.
Good morning. First of all, I would like to thank the organizing committee, especially to Dr. Benjamin Anderson and Dr. Casap for this invitation. In Chile last year, a consensus meeting on breast cancer was carried out, and we were very honored to have Ben as one of our guests. In this talk, I'm going to review with you the development of the Chilean guidelines for breast cancer treatment. Briefly, here I'm showing a few Chilean demographic data. Chile is a long and narrow country that's located in the southern and western part of South America, here. Almost 70 million people is the total population, and most of the people live in the cities. The first cause of death in Chile are the cardiovascular diseases, followed by cancer. With respect to cancer mortality, breast cancer represents the second female cause of death. As you can see over here. Breast cancer mortality has remained quite stable during the last decade. Now, some history that's necessary to understand how we got to the current guidelines. Back in the 90s, two parties were trying to put in order breast cancer care in Chile. The Chilean Society of Breast Diseases carried out two conferences that attempted to be consensus meeting in 1999 and 2003. On the other hand, the Ministry of Health defined the National Breast Cancer Program with two main goals, namely to assess the way breast cancer care was performed throughout the country, focus in the public system, and the organization of breast cancer care nationwide. By the way, this program was launched thanks to Dr. Cecilia Sepúlveda's initiative, who was at that time the head of the cancer unit at the Ministry of Health. And she's one of the panelists that we heard yesterday. So just to show you the impact of the startup of the program, the proportion of stage 0 breast cancer diagnosed rose from 3 to 8% between 1999 and 2008. Here, the program started in 95, and we achieved this increment in the proportion of DCIS diagnosed in those years, as well as the proportion of stage 3 cancers that fell from 36 to 24% in the same period. In 2004, a health system reform was carried out during the President Lagos administration. One of the goals of this reform was to improve patients' access to medical care and to improve quality of care for most prevalent diseases. A guaranteed system of medical attention was created called Explicit Guarantees in Health Care. This reform was based upon the existence of a non-equitable healthcare system. Breast cancer was included in the list of the most prevalent diseases in the country. To implement breast cancer care in the context of this reform, the Ministry of Health looked for the advisory of several specialists that were asked to design the guidelines for breast cancer diagnosis and treatment and a corresponding list of medical services that should be provided to put this guideline into practice. This work was done by O5. Obviously, most of the specialists that were consulted by the Health Ministry were members of the Chilean Society of Breast Diseases. These guidelines and list of medical services had to be reviewed every 2 years according to the law. Thus, we reached to the 08 scenario, in which the same team was duplicating efforts since the Chilean Society of Breast Diseases and the Ministry of Health were separately planning to review their respective previous guidelines. The Chilean Society of Breast Disease, the board of the Chilean Society agreed to carry out the third consensus meeting for the diagnosis and treatment of breast cancer. The purpose of this meeting was to review and update the 03 consensus. At the same time, the Ministry of Health was planning to review the 05 official guidelines. Unlike previous years, the Chilean Society of Breast Diseases and the Ministry of Health decided to join efforts, and we worked as a single team conducted by the Chilean Society of Breast Diseases. Subsequently, the board of the society defined 16 topics that were going to be reviewed in the third consensus, and you can see them in this slide. These were the same topics that we reviewed in the 03 consensus, except for the management of high-risk patients that were added in this opportunity. The board defined several specific questions by topic. For instance, one of the questions asked in the DCIS chapter was, should all DCIS patients treated with conservative surgery undergo postoperative radiotherapy? Regarding to the groups, 16 groups were set up. All the Chilean Society members were invited to be part of any group according to their practice and interest. I mean surgeons, gynecologists, medical oncologists, radiologists, etc. Besides, all the physicians that were related to breast cancer diagnosis or treatment all over the country were invited to join this initiative, regardless they were or were not active members of the Chilean Society of Breast Diseases. But to participate in any group, the condition was to become a Chilean Society of Breast Diseases member.